When substance abuse becomes a family matter, how to help and when to make them move into your house. If you have a loved one who is struggling with substance abuse, you may be wondering what to do. Substance abuse can be a difficult issue to deal with, and it can be hard to know when and how to step in. In some cases, it may be appropriate for the person with the addiction to move into your house. In other cases, it may be better to provide support from afar. In this video, we will explore the different options available to you and help you decide what is best for your situation. What are the ways to help a loved one who struggles with substance abuse? You can provide emotional support. This may involve listening to them and helping them to understand their addiction. You can help them find a treatment plan that works for them. You can provide a stable environment for them to live in and recover. You can keep an eye on them and make sure they are following their treatment plan. You can offer to drive them to and from their treatment appointments. You can provide financial support for their treatment. You can help them to find a job or get back into school. You can connect them with other people who are also in recovery. All of these things are important, and you should do what you can to help your loved one recover from substance abuse. When is it appropriate for a loved one with an addiction to move into your house? There are a few things you should consider before allowing a loved one with an addiction to move into your house. You need to make sure that you are able to provide them with the support they need. You need to make sure that you are able to maintain boundaries. You need to make sure that they are ready and willing to recover. If they are not, it may be better for them to find another place to live. You need to make sure that you are able to provide a stable environment for them. If you can answer yes to all of these things, then it may be appropriate for your loved one to move into your house. What are the risks involved in having a loved one with an addiction move into your house? There are several risks involved, and it is important to weigh the risks carefully. They may be tempted to relapse if they are living in the same house as you. There is a risk of relapse if the person does not receive adequate support. They may not follow their treatment plan if they are living with you. You may become overwhelmed and stressed out. There is a risk that you will enable their addiction. You may find it difficult to maintain boundaries. They may cause problems in your household. What are the benefits of having a loved one with an addiction live in your house? You can provide them with emotional and physical support. You can help them to stay on track and be able to follow their treatment plan for them to recover. You can provide a stable environment for them to feel like they have a safe place to live. When is it better for a loved one with an addiction to receiving support from afar? There are a few situations in which it may be better for a loved one with an addiction to receiving support from afar. You are not able to provide them with the emotional or physical support they need. They are not ready or willing to recover. You are unable to maintain boundaries. The environment you live in is not stable or safe. If you can answer yes to any of these things, then it may be better for your loved one to receive support from afar. It can be difficult to know what is best for a loved one who struggles with substance abuse. However, by considering the different options available to you, you will be able to make the right decision for them. It is important to remember that substance abuse is a difficult issue to deal with. You should provide as much support as possible, and don't be afraid to ask for help from professionals or other loved ones. With time and patience, your loved one will be able to overcome their addiction.